Today I will discuss funding a monthly free medical clinic in Wilkesboro, North Carolina. First, why is a medical mission in Wilkes County, North Carolina necessary? According to the Wilkes County Health Department, 21% of the population in Wilkes County lives below the poverty line. This is significantly higher than the state average of 16%. In addition, almost 15% of people under the age of 65 are uninsured. Goal number 3 of the United Nations Sustainable Development Goals is to ensure healthy lives and promote well-being for all at all ages. One way to work towards this goal is to increase access to health care in the area. According to Corbin and Fickert's book, When Helping Hurts, one of the main things that could benefit poor people in America is access to affordable health care. They suggest one way to address this issue is implementation of sustainable programs over long periods of time to implement ongoing change. To determine the type of program most appropriate for this area, I first considered the need within the community as indicated by Tazalar in the article about planning short-term mission projects. The most recent community health assessment in Wilkes County was performed by the Wilkes County Health Department in 2018. The resulting report identified the main priorities for health for the years 2019 to 2022. The 4 main priorities were obesity and chronic disease, mental health and substance abuse, access to care, and tobacco and smoking. Based on this needs assessment and the health priority of access to care established for this area, I determined that it could benefit from a free medical clinic once a month where people can come get a physical exam, have blood work drawn, and prescriptions refilled. It does not matter the status of health insurance. It is first come, first served basis that provides services to all. According to the Standards of Excellence in Short-Term Missions, empowering partnerships is an important aspect, stating an excellent short-term mission establishes healthy, interdependent, ongoing relationships between sending and receiving partner. This mission will work to establish partnerships with the local community college and local practitioners to sustain the mission after it has been established. To facilitate the ongoing success of this program, it will depend primarily on volunteers with one salary employee designated as the director to oversee the volunteers and ensure everything is in place every month. They will also serve as a primary contact in between each monthly clinic. The volunteers will include a physician or APRN each month to do physical exams and write prescriptions, someone to draw the blood work, someone to check in the patients, and someone to obtain vital signs. The blood draws and vital signs, we will look to partner with the local community to have their students come volunteer. We will work with the phlebotomy, nursing, and medical assisting programs at the local community college, which will give these students an opportunity to get practice with these skills. We've also partnered with a local clinic that has agreed to send at least one staff member each month to help and fill in as needed. The North Carolina Department of Health and Human Services works with the Office of Rural Health to advance health, safety, and well-being of all North Carolinians. These organizations put an emphasis on the collaboration of community partners to achieve this goal. They offer many rural health grants, and Jenny Ingram is the main point of contact and can be reached at this email or phone number. So to provide our services, we will depend on grant funding and also donations. The North Carolina Department of Health and Human Services has a community health grant that will be used to cover the salary of the director, the initial cost of medical supplies, and any fees associated with necessary referrals to specialists, along as help pay for prescriptions that patients are unable to pay for. A local anonymous donor has donated a building to be used each month, and LabCorp has agreed to donate the supplies necessary for lab draws and the cost of the routine lab tests. This community health grant is open to organizations providing direct primary care and preventative care, including free and charitable clinics, health departments, rural health centers, and school-based health centers. The funds can be used for health promotion, maintenance, and counseling, including disease prevention, patient education, and diagnosis and treatment of acute and chronic illnesses. Applicants are scored based on summary and evaluation of criteria and baseline data, budget, and grant narrative, with the high scoring applicants receiving 3-year grants and the others receiving a 1-year grant. There are 2 tracks that can be applied for. Track A is a service pay for service reimbursement program, and track B, which we will be applying for, is reimbursement for eligible expenses. Once the grant is awarded, the money is distributed monthly based on a submitted monthly expense report. In addition, a startup cash advance is also available. Knowledge check, true or false? Wilkes County is a rural county in North Carolina with a lower than average poverty rate compared to the rest of the state. This is false. Wilkes County is a rural county in North Carolina, but the poverty rate is higher than the state average. Implementation of a monthly free medical clinic would work to achieve one of the United Nations Sustainable Development Goals. This is true. One of the United Nations Sustainable Development Goal number 3 is to ensure healthy lives and promote well-being for all at all ages. Thank you.